Hi, this is Brain Bites with Dr. B. Today I'm going to be talking about emergency contraception, otherwise known as the morning after pill. We see a lot of people struggling with depression and anxiety, and an unplanned pregnancy can have serious impacts on mental health, whether there's a current diagnosis or not. Since I started my own private practice, I see a lot more younger patients than I used to, and this has been something that I've been paying more attention to in the past year. Previously, I didn't really talk to my patients about emergency contraception, although I talked regularly about what form of birth control they currently use. So I asked every female patient, anybody who had the hardware or still has it, about what their plan is, because sometimes things don't go as expected. So a lot of the medications I give should warrant a discussion prior to pregnancy to see where mom falls on the risk-benefit scale. In general, I vote for treating mental health conditions with the safest medication options possible versus having an extra stressed or depressed mom growing a fetus. But more than anything, I like having time to plan and discuss this before it becomes a rushed situation. Sometimes that's not an option though. People may miss a shot, they forget to take their pills, the condom breaks, or an unexpected sexual encounter happens. These emergency contraceptive options are something that can be available at the ready. The goal is to have it ahead of time. Ideally, this is an emergency plan only and is not the main plan for managing birth control. Sometimes people struggle finding a consistently safely used form of regular birth control, but still, this shouldn't be the go-to plan for birth control. It should be reserved for emergencies. Not everyone can tolerate hormonal treatments. IUDs can be expensive and not everyone wants that. Cervical caps can slip and condoms are still just condoms. Still, I saw a stat that almost half of US pregnancies are unplanned. So let's have another option for something to do about this. So why am I telling you guys about Plan B? Why am I telling you guys about the morning after pill? Well, right now there are two emergency contraceptive options. The first one is ulipristal acetate. That's also called Ella, and that's what I'm going to refer to it as. That one does require a prescription, so a doctor would have to write for that. The other one is levonorgestrel. That's also known as Plan B. That one is available over the counter and also with a prescription. So it depends on the patient preference. So the reason that I'm telling you guys this is because there is an over-the-counter option. And this is something that you can discuss with your clients. If there's a risk of an unplanned pregnancy, now they have some options. So the important things to know about this is no labs or exams are required before taking the morning after pill, whichever version the client takes. If somebody's already pregnant, it will not harm a pregnancy. So this doesn't hurt anything. So if there were a couple of different instances, the client is already pregnant, and then there's an instance where they're like, oh no, the condom broke, and they didn't know they were pregnant, and they take the morning after pill, it will not affect the pregnancy at all. That's totally fine. And it's safe in breastfeeding. So that's also good to know. So the way it works is it just prevents or delays ovulation. So if implantation has already occurred, there's no effect at all. That's why it's safe for pregnancy. So one of the important pieces of that is that if you take the morning after pill, it can throw off the cycle a little bit. So there is a greater risk of pregnancy if you're not continuing to use some sort of birth control in the meantime. Specifically with Plan B, it can be bought over the counter. It can have a script or no prescription, and you can even order it online. It's stocked at most pharmacies pretty regularly, but it's generally behind the counter and it can be locked up. And not all staff know that there's no age or sex requirement to purchase it. So they may ask to see an ID or something like that, but it is not required. For Ella, you do need a prescription, and it is less available, but it's generally preferred because it's more effective. But both options are still better than doing nothing. So for Plan B, generally it's effective within 3 days of the sexual encounter. So we call these the morning after pill, but it doesn't have to be the morning after. It can be immediately after the sexual encounter, up to 3 days. Now, if they don't have Ella available, you can in theory, take the Plan B until 5 days after, but it is less effective in that 3 to 5 day window. Another important piece of information is for overweight or obese patients, there's the possibility that Plan B is not as effective as Ella, so that may be another consideration to choose one over the other. Both of these forms of emergency contraception are very well tolerated. There are few side effects, and it's just a single dose. So the most common side effects that you see in about 19% of patients, they might get headaches, and in 12% nausea, and in a few others there may be irregular bleeding, fatigue, dizziness, and maybe some mild abdominal pain. So the side effect profile is very mild, and because it's a single dose, it shouldn't interact with a lot of other medications, whether they're psychotropic medications or not. An important thing to remember, though, is that this doesn't stop sexually transmitted infections. This is just for pregnancy, and it just delays ovulation. Because it affects ovulation, it may mess up the following cycle by a week before or a week later. There may be spotting, there may be more or less flow or more or less pain. So it may not be a typical expected cycle the following cycle after taking emergency contraception, but it should even out after that. Also of note, having an IUD placed within that small window of time is also considered a form of emergency contraception, but it's pretty hard to get it scheduled just in time. But it is something else that is considered. So I bring this up because, again, this is something that your clients can ask for. This is something that can help keep them at ease, knowing that they have it available. The goal is to have it already. They can ask their doctor to write a prescription for either one of these medications, Ella being the one that's generally preferred because it's a little bit more effective and the time frame from when you need to take it is a little bit longer. But the idea would be to get the prescription and get a couple of refills, go pick up at least one and keep it close by. Have it handy so it's available when your client needs it. The idea is not to wait until you need it and then take the prescription to the pharmacy. And especially with Ella, that is not often stocked at pharmacies, so they have to get it in from somewhere else. So it may take a few days just to get the medication in. So it's best to have it ahead of time. Then, if it's needed, you can go pick up a refill and have another one waiting in its place. This shouldn't be used on a regular basis, though. Like I mentioned before, this is not a standard form of birth control to use regularly. It is considered emergency contraception. So come up with a plan with your primary care doctor, with your partner, whatever you need to do to come up with something that's going to work well for you. But know that for you or your clients, this is a great backup plan to have. All right, that's it for today. This has been Brain Bites with Dr. B.